Summer reading is in full swing. Visit summerreading.queenslibrary.org for our full summer reading program schedule, book list for all ages, and other resources to keep your kids engaged and learning all summer long. Plus, don't forget to participate in our reading challenge and social media sweepstakes for a chance to win some cool prizes. Queens Public Library, along with the New York City Department of Education, will be providing free lunches for all children under 18 throughout the summertime. Summer meals will be offered Monday to Friday from 1 to 2 p.m. through August 31st. Enrollment is not required and there is no cost. For more information and a list of participating libraries, visit queenslibrary.org. Back to school is around the corner. Visit queenslibrary.org to see all of our back-to-school programs and giveaways, and to read our guide with helpful tips on family communication, book lists, and more.
Welcome to Wellness Wednesdays. I'm Christopher Galarza, Queens Public Library's Community Health Educator. Today, we are joined by the Office of Citywide Health Insurance Access, who will discuss different insurance plans like Medicaid, Child Health Plus, the Medicare Savings Programs, and Emergency Medicaid. Thank you for joining us, and without further ado, Audrey, please take it away.
Hello, good afternoon, everyone. I hope everyone is having a fabulous Wednesday. Today, Shauna, Patrick, and I will talk to you about available health insurance options in New York City. We are both from the Office of Citywide Health Insurance Access, which works to connect New York City residents, small business owners, and their employees to coverage and care. We also work to ensure that people 65 and older have Medicaid and help to pay for Medicare costs. So today I am going to talk to you about health insurance programs for people under 65, how to get them, where to enroll, how to choose a plan, and coverage for I was going to say children, but for young people aged 26 to 29, NYC Care, IDNYC, as well as Access HRA. So I told you a little bit about our office. The primary way that we engage with New Yorkers is one, through our website called New York City Health Insurance Link, as well as a broad network of partners, which Queens Library, we're happy to say, is one of them. And we also do tabling, workshops, and presentations in the community. And all of the work that we do is supported by policy research and analysis. And Shauna will talk to you more about our work to connect those 65 and over living with a disability or visual impairment to coverage and care. So, how do people in New York get health insurance? Well, people under 65 primarily get health insurance through the New York State of Health. The New York State of Health is the official health plan marketplace, also known as an exchange, to help people get covered. It's mainly for individuals under 65, businesses with 100 or fewer employees, and most people with employer-sponsored coverage are not eligible for tax credits, but can still go to the marketplace to enroll and pay full cost for coverage. The wonderful thing about the marketplace is that it's one application for both public or private health insurance, and the information that you put in determines the plans that you may be eligible for. You can compare plans, enroll online, or you can get free help, in-person help to get enrolled. The most important thing to understand and remember about the New York State of Health, that it's the only place to get tax credits to help pay for the cost of coverage. And the in-person help that I referred to previously is through navigators who work for community-based organizations, certified marketplace facilitated enrollers who work for health plans, and certified application enrollers counselors who can work for the city, as well as community-based organizations. In the marketplace, you'll find Child Health Plus, Medicaid, the Essential Plan, and private health insurance through qualified health plans. Medicaid is free, the Essential Plan is free, and Child Health Plus is free or low cost or full cost. And when I talk about Child Health Plus, I will talk about an exciting new feature. Qualified health plans are either full cost. Some people, depending on income, will get not only help to pay for the monthly cost of premiums, they will get extra help to pay for out-of-pocket costs such as co-payments, deductibles, and co-insurance. So Medicaid, how can people in New York get it? Well, your income must be below $1,563 a month. Couples earning up to $2,106 can also get Medicaid. And pregnant women carrying one child can earn up to $3,403 a month. The thing that you will see here is that it specifically says carrying one child, and that is because a pregnant woman, depending on the number of children she's carrying, will be considered that. So, for example, if a pregnant woman is carrying 3 children, she's considered a household of 4 and will have a higher income eligibility. If for Child Health Plus, a child in a family of 2 can earn up to $6,000, 103, and single adults earning up to $2,265 a month can get the Essential Plan. So the Essential Plan is available for people whose income eligibility is over the Medicaid level. So private health insurance through qualified health plans is available for those whose income is above the Essential Plan level, and single adults earning up to $2,684 can get tax credits and again help paying for co-payments, deductibles, and co-insurance. You notice I'm not going over each income eligibility level. Just know that as your household size increase, the income eligibility also increases. And for the past 2 years, under the Biden administration, the American Rescue Plan increased financial assistance to help people pay for monthly premiums. And for the first time, people whose income was higher than 400% of the federal poverty level were able to get tax credits. So the covered benefits include free preventive care, emergency services, maternity and newborn care, as well as prescription drug coverage. And I will always mention mental health and substance use disorder services. Particularly mental health services are needed in this time of the public health emergency. The key thing I want you to know about Medicaid is that Medicaid is available to people prior to their time that they enroll. So, for example, if I enroll in Medicaid this month, it's August, and I have bills from June, as long as I was eligible for Medicaid in June, Medicaid will go back and pay my medical bills in June. So Medicaid can go back 3 months to pay for medical bills. The 10 benefits that was on the previous slide are also covered. Some recipients may be required to make small co-payments. And if you're under 65, you apply through the marketplace for Medicaid. Over 65, you apply through our agency, the Human Resources Administration. The key thing I want you to know about Child Health Plus is that it's available for all children in New York, regardless of immigration status. That is, children under the age of 19. And new beginning October 1st, there have been an elimination of the $9 a month premium. So children up to a certain income level will no longer have to pay a $9 premium for Child Health Plus. It will be free. The Essential Plan has no premium, and all plans include dental and vision. There's no deductible, and it provides the same covered benefits that I mentioned earlier. And it's available for adults under 65 who are not eligible for Medicaid, Child Health Plus, or who don't have affordable minimum health insurance coverage. So qualified health plans is private health insurance. It covers the same 10 benefits that I previously mentioned. They're the only place to receive financial help to pay for the cost of coverage is through the marketplace. And the most important thing to understand is that you ensure that you understand the costs, not just the monthly premium, but what your out-of-pocket costs will be, and that the provider networks are those that you want to frequent. What do you need to know to enroll? Well, you have to know your citizenship and immigration status, social security number, date of birth for everyone in the household who is applying, employment information, as well as household income. Important to note that enrollment in Medicaid, Essential Plan, and Child Health Plus is available all year round. And because of the public health emergency due to COVID, everyone enrolled in Medicaid, Essential Plan, and Child Health Plus whose eligibility, or I should say authorization, ends through October 31st of this year will be automatically renewed. So if you have a coverage end date, let's say of September 30th, you do not have to renew. Your health insurance coverage will be automatically renewed for another 12 months. So choosing a plan, it's important to think about the benefits that you need, ensuring that the prescription drugs that you're taking are covered, as well as the doctors and other providers you want to see are included. That is, the hospitals, the pharmacies are all part of the network. Coverage costs that should be considered is not only the monthly premium. It's important to consider co-payments, deductibles, and coinsurance. All of these things will help you determine if the cost of private health insurance is affordable to you. And you can learn more by visiting our website at the site listed here. And this is our website, nyc.gov/HILINK, where you can get more information on health insurance and what's available. If you're under 26 or you have a child under 26 in New York, they can stay on their parents' plan. And I should say this is throughout the United States. The requirements are that the child can live in and out of the parent's home, can be married, have a child. They are not claimed as a tax dependent, and they can turn down and offer a job-based coverage. They can remain on their parents' plan until they turn 26. If they're on a parent's plan through the New York State of Health, the marketplace, they would be covered through December 31st of the year they turn 26. In New York, we also have an age 29 law, and that law extends coverage. It's a little bit more expensive than the age 26 law, because age 26, as long as you have family coverage, you won't pay additional money by keeping your children on. But the age 29 law is a little bit more expensive. You're paying the cost of coverage plus 2% administration fee. And the requirements are a little different. The young adult must be unmarried, under 29 not be able to have health insurance, live or work or reside in New York, and they don't have to live with their parent. So in New York, we also have health insurance options as well as coverage options for undocumented immigrants. And those include Child Health Plus, which I talked about. Medicaid is also available for pregnant women. The pregnant woman does not have to meet the citizenship and immigration status, but they just have to meet the income level as well as reside in New York. Medicaid for the treatment of emergency medical condition is also available, and Shona will talk more about that. And care is available at hospitals and community health centers on a sliding fee scale. And I will talk also about the healthcare access program through the city's hospital system, H&H. And you can learn more about available low-cost options at nyc.gov/OCHEA low-cost care. So this is the NYC Care program. Available is primary care. As soon as a new enrollee enrolls, they will have access to a primary care provider as well as an appointment within 2 weeks. They will also be connected to specialists. The goal is to ensure that people have a continuity of care. You get a membership card, and on the membership card, the primary care doctor is listed, as well as there is all the costs. So there's no surprise costs. You'll know what it will copay will be for your primary care visits, specialty visits, emergency care, as well as pharmacy. There's also a 24-hour member number, 646 NYC Care. And the eligibility includes people who are unable to be insured because they're undocumented, or for whom the cost of coverage will be more than 8.6% of their income. And they must live in New York City. There's no time frame to live in New York City. If you come from another county or state, and as long as you can show that you're a resident of New York City, you would be eligible to enroll. And how does one enroll? You can call 646 NYC Care, or same number, 646-692-2273, and someone will help you to enroll. IDNYC. IDNYC is also a wonderful benefit offered by the city. I have my IDNYC card. It's a card that allows people who are unable to get other identity to go into a city's building, go into city buildings. It can be shown to NYPD for the purposes of issuing its summonses. It can also be used to get proof of work authorization. Or I should say, it can be also used as identity when submitted with proof of work authorization. It is not just for although undocumented individuals can avail themselves of it. I have it because it allows me to get access to the city's cultural institutions, which I'll talk more about. So the eligibility for the IDNYC card includes a person must be 10 years old at minimum, live in one of the 5 boroughs, be able to provide 3 points of identity plus proof of residency, and one identity document must have a photo and date of birth. All documents must be original cards. This is what the NYC identification card looks like. Mine looks like the first one, and the new card design you see on the right. So this is where all the card is accepted. And these are the cultural institutions that will, when one enrolls, will provide a free 1 year membership. And so what you'll see is the Queen's Museum, the American Museum of Natural History, uh, the St. George Theater, amongst other institutions. So it's a wonderful card to have, and I will encourage everyone to get their IDNYC card. Access HRA. Access HRA is a way for our agency to easily communicate and provide benefits to New Yorkers. One can apply for SNAP benefits, cash assistance, recertify a cash assistance or SNAP case, submit emergency one-time assistance, and apply for fair fares, which I will talk more about. We also have a mobile app on which you can upload documents, read notices from our agency, view case details, including upcoming appointments. And as I mentioned, one can apply for fair fares the through Access HRA, and Fair Fares is a Metro card that one would receive that to which you add value, but when you go to use it, only half the fare will be deducted. And it is available to people 18 to 64 who are New York City residents and whose income is below or at 100% of the federal poverty level, and they are not receiving other transit benefits. And so this is an example of an income. So a single person must earn under $13,590 to avail themselves of the Fair Fares card. So it's a wonderful card. It comes with a zero balance. You add the fare that, or the amount of money that you would like. And instead of swiping, when you swipe, taking off $275, it will take off $135. So it's a wonderful card. And with that, I will end the presentation and just remind everyone that if you know someone who needs to enroll, they can call, or if you need to enroll, you can call 311 or text Covered NYC to 877-877 to get free enrollment help. You can also yourself go online at newyorkstateofhealth.ny.gov to enroll. You can also call the Marketplace, the New York State of Health, at 855-355-5777. And with that, I would like to end the presentation, ask if there are any questions that I can answer before Shauna talks about coverage and care for people 65 or over living with a disability or visual impairment. Are there any questions? So if you have any questions, you can write them in the comments and they will read them to me. Okay, I don't. So if there aren't any questions, I will turn it over to Shauna Patrick.
Good morning, everyone, and thank you for attending Queens Public Library's Wellness Wednesdays. As Audrey said, my name is Shauna Patrick, and I am with the Office of Citywide Health Insurance Access. So today, I am going to be speaking to you about insurance options for New Yorkers, specifically New Yorkers who are aged 65 or older, living with a disability or visual impairment. So there are some core benefits that the Human Resources Administration offers New York City residents. And the Office of Citywide Health Insurance Access is part of HRA. So there are cash assistance programs, medical insurance programs, as we're going to discuss today. Audrey mentioned IDNYC, home care services, emergency food services, and so on. Audrey went over what the Office of Citywide Health Insurance offers. So I'm going to jump right in and just talk about who are considered aged, visually impaired, or living with a disability. So specifically, those who are aged are 65 years of age or older. Visually impaired, meaning they are certified blind by the New York State Commission for the Blind. Or they are people who are living with disabilities who have been certified disabled by the Social Security Administration, the New York State Medicaid Disability Team, or uniquely for New York City, NYC Medicaid Disability Review Team. We will talk about Medicaid as it pertains to and includes institutional care, such as nursing home care. We'll be discussing the Medicaid buy-in program for people who are working and living with a disability, Medicaid excess income program for when you go over some of those dollar amounts that I'll be discussing with you, and then talking about Medicare and then the Medicare savings program. So during the COVID-19 public health crisis, there were some things that were waived, so to speak, in order to help people apply, since applying in person was not something that was available. So there were some things that we were able to overlook as you were applying, but what we were not able to overlook is your citizenship and immigration status. So you still had to prove, so to speak, that you were either a citizen or that you were of an immigration status that would allow us to be able to move forward with helping you apply or qualify you to be able to apply for Medicaid. You were able to attest or say that you are a resident of New York City, tell us who you are, attest or say, hey, this is how much income I make, and also say what sort of resources that you had available to you. And we'll talk about those things a little more specifically. So the things that we look at to determine your Medicaid eligibility is your residency. There is no time requirement, so you can actually be living in New York for one day. You just have to be able to show, either through a rent receipt or a lease, a letter from the landlord or the person that you're living with, that you reside at a New York City address. To prove your identity, you can supply a US passport, a naturalization certificate, a driver's license, photo ID issued by an employer. Medicaid eligibility and income and resources. For income, for a single person, that would be $934 a month or $208 a year. If you are a couple, that would be $1,367 a month or $16,404 a year. For resources for a single person, that'll be $16,800 in total resources, and for couples in total resources, $24,600. So when we speak of resources, what do we mean? Resources are looking at things that you may have, such as bank account balances, or if you have investments such as an annuity, or if you own a property that is up to a certain dollar, beyond a certain dollar amount. Those are the things that we look at and we considered as resources. Income could be something like Social Security payments, IRA that is in payout status, or child support payments can be considered income, or you just have income coming in from some kind of work that you are doing where it generates income for you on a weekly or monthly or annual basis. There is something available, Medicaid, for the treatment of an emergency, which is emergency Medicaid. And how do you qualify for emergency Medicaid? You would have to live in New York. You are undocumented or a temporary non-immigrant. So emergency Medicaid would be for someone who is not a U.S. citizen or a permanent resident. It is a person who has temporary status or undocumented status in the United States. You would need to meet the income eligibility, which are the things that I talked about previously, income and resource eligibility. And for those who are 65 or older or living with a disability or visual impairment, your application can be a little bit more complicated. So our program helps you apply for emergency Medicaid as well, and you would get that help applying for emergency Medicaid by calling 347-396-4705. So what is considered an emergency medical condition? The long short of it is that the physician or the person, the medical personnel that is treating you would make that determination that what you are experiencing right now is classified as an emergency. Now we will transition over to the Medicaid Excess Income Program. So the Medicaid Excess Income Program provides Medicaid coverage to certain individuals, and those certain individuals are people under the age 21, people who are 65 or older, or certified blind or certified disabled, pregnant, or a parent or caretaker relative of a child under the age 21. So it essentially talks about if you meet those qualifiers that we just talked about, and you are over those dollar amounts that we talked about earlier, you are exceeding those dollar amounts. For example, as a single person, you're exceeding that $984 a month in income. How then can you still qualify for Medicaid? And there is some ways that you can do that, and we'll talk about that in a little bit more detail. Then we have the Medicaid buy-in program for people who are working and living with a disability. So you'll notice that the parameters are a little higher for a person. What I mean by parameters are, what are those dollar amounts that a person who is living with a disability, what are those dollar amounts that can still qualify you to be able to qualify for Medicaid as a working person? So you'll notice now those numbers are significantly higher than the dollar amounts that we talked about earlier. For a single person, that is $2,832 in income. And for a couple, that's $3,815 in income for a couple. And for resources, for a single person, it is $20,000 in resources, and for a couple, it's $30,000. And again, we're talking about as income, regular paychecks, Social Security payments, child support payments. And for resources, we're looking at bank account balances, if you own stocks, bonds, individual retirement accounts, also known as IRAs, and things that have some sort of cash value, such as life insurance policies. So now we're going to transition and talk about Medicare. So Medicare is a federal public health insurance for people who are 65 or older, or some people who are some people living with disabilities, and people with end-stage renal disease. There are two types of Medicare. We have the public plans, right? And then we have Medicare Advantage or private plans. So you may be familiar with those commercials that come on TV where they talk about these Medicare programs that you can enroll into. Those will be the private plans and Medicare Advantage. And then we have original Medicare public plans. So many of us have heard of Part A, Part B, and Part D as in David for that offers prescription drugs is Part D. And Part A covers hospital insurance. So what's that? That's for care in a hospital, a nursing facility, receiving care at a nursing home, or home health care. Part B, as in boy, covers medical insurance, such as ambulance services, durable Medicaid equipment. What does that mean? It means, for example, a person who has diabetes, and so you'll have certain equipment that helps you manage your diabetes, stay on top of your diabetes, such as test strips, blood sugar test strips. And then Part B would cover things like if you need a walker or a cane. And Part D, I mentioned earlier, and is self-explanatory, it's prescription drugs. So Medicare Advantage plans, those private plans, they have a lot of those bells and whistles, which may include other services as vision and dental, and cover such thing as hospice care or end-of-life care. So to qualify for Medicare, you would need to be a U.S. citizen or a legal permanent resident living in the U.S. continuously for 5 years. Be 65 and older. And if you're a person that for 24 months, 2 years, you receive Social Security disability, then that is another way of qualifying or being eligible for Medicare. People with Lou Gehrig's disease or ALS, end-stage renal disease, do not have to meet the 24-month requirement. So that is a way of qualifying for Medicare eligibility beyond just your age. So Part A premiums, we talked about Part A earlier, and Part A is hospital insurance, are free for people if they or their spouse has 10 years or more of working history. That is 40 considered, those 10 years are considered 40 working quarters. People can still get Part A, but for those who have not met that 40 working quarters, those 10 years, can buy Part A if they've been lawful residents for the 5 years that we talked about earlier. For this current year, 2020, Part A premiums for those who have less than the 40 quarters or 10 years would be $499 a month. Or for people who are between 30 to 39 quarters, closer to that 10-year mark, they pay less than that $499, $274 a month to qualify for Part A. So Medicare eligibility and how much you pay for Part B for an individual who files a tax return based on income earned in 2020. So for a person who is filing an individual tax return, would be paying for their Part B premium, which is medical insurance, and again covers things like ambulance insurance or canes and walkers and things of that nature. That person, if they have income up to $91,000, and again, we're looking at what did you claim or what did you show as your income on your, not prior year, your tax return from 2 years ago. There's like a lag, right? So for 2022, we're looking at your 2020 income, and if your 2020 income showed that you made up to $91,000, you will be paying for Part B $170.10. For Part B, if you're making income between $91,001 or $114,000, it'll be $238.10. And you'll notice you pay $578.30 if your income is greater than or equal to $500,000, which is $500,000, which I think if you're making that much money in income, I think you should be paying more, but that's just me. So then let's talk about the Medicare Savings Program, right? What can help you save on paying for those premiums that we just talked about? What can help you save in that? Well, there are currently 3 programs, QMB or QIMB, which is the Qualified Medicare Beneficiary Program, SLIMB, the Specified Low Income Medicare Beneficiary Program, and QI1. And you'll notice that it says you cannot be in receipt of both Medicaid and QI1. You'll also notice that to qualify, to be eligible, similar to the other programs that we talked about earlier, your income has to fall within a certain dollar amount. All right, so for QMB, monthly income for a family of 1 is $1,074. And for a family of 2, $1,452. And SLIMB is the same. Monthly income for a family of 1, $1,288. Family of 2, $1,742. So I think you guys get the idea that you're looking at income to see if this person qualifies, right, for these Medicare savings programs. So what does QMB cover? QMB covers Part B monthly premium, which includes penalties for late enrollment. So if you somehow, for some reason, did not enroll in time, and that means that you did not enroll 3 months prior to turning age 65, the month that you turned age 65, or the 3 months after turning age 65, then you are subject to some penalties. Okay, so Part B, if you qualify, you will receive Part B monthly premium which includes penalties for late enrollment, deductibles and coinsurance, Part A premium for people who have not worked, that requires 10 years of work history either for you or your spouse, and so on. So there are certain things that you get when you qualify for these programs. SLIMB covers Part B premium, including any penalties for late enrollment, and you can receive SLIMB benefits 3 months before the date you apply. So Audrey, in her presentation, talked about you qualify for it. They can look back and go back 3 months, and if you have bills in those prior 3 months, prior to when you qualified for the program or applied for the program, hey, what medical bills did you incur in that period of time? It can be covered through SLIMB or paid for through SLIMB. And for QI1, it's similar. You can receive QI1 benefits up to 3 months before the date you apply. And the date is counted back from the date of application. So recently, some months prior, our Governor Holcomb signed some budget expansions I'm sorry, I misspoke. Recently, the New York State budget that was signed by our governor or approved by our governor expanded some Medicaid eligibility benefits. So starting in January 2023, Medicaid income eligibility for people 65 and older and people living with disabilities will increase. The Medicaid resource limit for people 65 and over and people living with disabilities will also increase. And the income eligibility levels for Medicare Savings Program for QMB and QI1 will also increase. Slim B will no longer exist in New York State, as everyone who had Slim B will now get QMB. And effective in March of 2023, undocumented immigrants who are age 65 and older will now be eligible for Medicaid. New York State put into their budget an expansion of Medicaid to people who are undocumented and age 65 and older. So for older adults and people living with a disability, you receive Medicaid through the Human Resources Administration. Older adults and people with a disability can receive Medicaid through the Human Resources Administration. If disabled and under 65 years of age, an individual can also get Medicaid through the New York State of Health Marketplace that Audrey spoke of. You must renew your Medicaid coverage every year, either through HRA, if that's who approved your application for Medicaid, or the New York State of Health Marketplace, depending on where you are enrolled. For individuals looking to apply for Medicaid through the program that we are talking about today, the Facilitated Enrollment Program, you can call 347-396-4705 for free enrollment assistance. So for people 65 or older, or living with a disability or visual impairment, you can get help enrolling for Medicaid and the Medicare Savings Program through calling 347-396-4705. Earlier today, Audrey spoke of Access HRA, so I won't be speaking of that. And she also spoke about Fair Fares as well. So, with that said, we're coming to the end of my presentation. Do we have any questions? Okay, I am not hearing any questions. So if there are no questions, we thank you very much. I thank you very much for your time, for joining us today.
Hi, Shauna and Audrey. Thank you, everyone, for joining us. You can still put some questions in. I have a few questions. So, Shauna, you mentioned about those penalties for not signing up when you're 65. Can you speak more about that? Because I think more and more people are retiring later. They're keeping their work insurance, and I think they're a little confused that they have to enroll even if they have their own insurance. So can you speak a little bit more about that? You know, just like where should they go, and that they still need to be doing this even if they have insurance of their own? Or Audrey?
Yeah. Do you want to speak, or would you?
Go ahead, Audrey.
So if, let's say, a person is going to retire not at 65, they still should contact the Social Security Administration, who is responsible for Medicare enrollment, and let them know that they are still working and have employer-sponsored coverage. They should still take Part A. Mm-hmm. But Part B, they can take later. However, it's important to let the Social Security Administration know that you're still working, so that the penalty that Shauna mentioned does not come into play. So even if you continue working beyond 65, it's up to you as an individual to alert the Social Security Administration of your plans. And why is the Part A important? Because Part A, there's no cost to you as long as you do your 40 quarters of work. So it's important to keep, and as soon as you turn 65, or I would do it. I would do it 3 months before I turned 65. I was alert the Social Security Administration. I'm still working. At this time, I am not going to take Part B, and that will be noted, and you will not be subject to the penalty.
And then at a future date, can you enroll into Part B if
Yes, you can. You can enroll into Part B without any penalty, but you just must keep the Social Security Administration apprised of your plans.
Great.
So Audrey mentioned contacting Social Security and making them aware of that. And then there's another resource that we have available to us, and that is something called HICAP, which is the New York City Health Insurance Information Counseling and Assistance Program. It's a long name. And HICAP also is a helpline for people with Medicare, or that can also help kind of like answer some of your questions about getting just a little bit more knowledge about Medicare, right? So they're an information and an education resource available. But like Audrey said, in terms of notification and saying, hey, I'm still working, whatever the case may be, or even if I'm getting health insurance through my spouse, those sort of things, you need to cover that and get that on record with the Social Security Administration. To contact HICAP, you can call 311, and then they will be able to route you towards HICAP, who can give you some of that education and advisement with that, kind of of it.
And they also have classes that you can take to help you gain better knowledge. Because Medicare, I always say that I need another 20 years of this work to learn Medicare, because it's complicated.
And can you speak a little bit more about, we have more and more people living with chronic conditions as they get older and may need more like long-term health insurance kind of needs. Can you speak about more of those type of plans with Medicare and Medicaid and how that process should go about? Should they be contacting the New York State of Health? Should they be contacting their insurance?
Okay. So if they want you're saying if they want a supplementary insurance, or they can use a Part C, can also act like a supplement, and meaning you get additional benefits. I think what Shauna mentioned before is definitely talking to HICAP, because they have the knowledge as it relates to these third-party health insurance plans, how they work, which ones depend, because each person's situation is a little different. And so people shouldn't just go out and enroll in a supplementary plan. They need to know which one works best for them in terms of where they live, the services that they need. That's really important. So HICAP is a valuable resource.
And Audrey, correct me if I'm wrong. When we talk about the penalties for not enrolling, right?
For not enrolling in Part B, yeah.
It's 10%, and that's 10%
every year.
Yeah. So that's an ongoing penalty. So you don't want to do that.
And it cannot be reversed. So it is better. Did we if people didn't, if people didn't, I want to reiterate this, if people didn't enroll at 65 because of the public health emergency, they can contact the Social Security Administration for relief of that penalty through December only. So let's say for some reason you couldn't get through. There was, the Social Security Administration, a lot of folk, the offices were closed. They had a lot of calls. People weren't able to get through. I wasn't able to get through. So accordingly, I wasn't able to enroll. Please provide me with relief, and the penalty will be hopefully disregarded, but only through December. Because I'm sure there are people during the pandemic who were in that situation.
And the 10% that we're referring to is 10% of whatever your Part B premium would have otherwise been. And that's based on income, right? So it's 10% of whatever that is.
Okay, so if your premium, I'm just giving out a number, is 170, then that means each year you're going to be charged $17 for not enrolling.
Correct.
Okay,
Yeah.
Yep.
that's very important. Is there, I'm not seeing any, what's the grand takeaway that you really want to drive home just so that, it sticks in people's minds once we leave today?
I'll speak for under 65. The grand takeaway is that if you need coverage, if you know someone who needs coverage, go to the marketplace, because no one can determine your eligibility or tell you you're eligible or not eligible but the marketplace. So even if you're not sure, you're uncertain, you're scared, just go apply. Whether you're documented or undocumented, it doesn't matter. The marketplace will determine if you are eligible. So if you're in doubt, go to the marketplace, enroll. Because even, let's say you're undocumented and you're not eligible, there is NYC Care for you. So just make sure you go to the marketplace and go through the enrollment process. And if you know anyone, let them know as well.
So the grand takeaway for me would be, if you are 65 and older, living with a disability or visually impaired, and you're looking to get Medicaid, there is a resource available in New York City to help you do that. And you can get to that resource by calling 347-396-4705. The other takeaway, as it pertains to questions about that'll help you understand Medicare, eligibility, and so on, you can contact the HICAP program, right? So it's better to be informed and prepared than to be scrambling and looking to see, how do I avoid this penalty? Now I have this penalty, so on and so forth. So that would be actually 3 takeaways. Call 347-396-4705 so we can help you get enrolled in Medicaid or the Medicare Savings Program. Contact HICAP for education. And as Audrey was saying, get in touch with Social Security. If you don't need to take, or you don't think you need to go ahead and get enrolled in Medicare because you have insurance or you're still employed, go ahead and contact them and get on record and make sure you're not subject to that headache, that future headache. Just avoid it altogether. So those are my 3 grand takeaways.
Great. And what I heard from both of you is that no matter what your age is, make sure you reach out, because there's people here to help out. If you have any questions, concerns, or anything, it's better to speak to someone and figure out how to get health insurance than to just not have health insurance.
Exactly. Absolutely.
Great.
Yeah.
Yep.
Yay.
So I want to thank you both so much. Thank you for joining us. And thank you, everyone, for tuning in for this week with Wellness Wednesdays. And we'll see you next week.
All right.
Thank
Thank
you.
you. Okay.